forming their own consortiums to identify within their own respective research environments potential innovation and pulling their assets together to both identify and help them. So we know, universities have special funds for startups. Some of them have actually venture capability. But doing that at a state level more collaboratively, and also leveraging with state resources, the SBIR grant, states 1 and 2, get a critical mass is one path. Because I think you're completely right. I hear every day about, somebody has the answer to testing. How do we get to the FDA, for approval? And so I do think that, yes, there's the federal level, the White House Science Office really should be playing a role coordinating some of this, but it would be very exciting to see how some of the states themselves and the universities within the states would pool their resources to help on identifying and promoting these startup capabilities coming out of their assets. And the other thing I think I'll mention is, we've talked a lot about demand and the mission focus, but certainly, this is now a national mission to ensure that we have the preparedness, we have the anticipatory R&D investment, so the next time we have a pandemic, and there will be one, we can respond in a resilient, adaptive way, and not be scurrying around the way we've had to do this time, really for a lack of organization, I think, not capability.
No doubt we should leave out the small competitors who have possibly a potential for vaccine, for a cure, or for good research.
We should make sure they're part of the solution, absolutely.
Thank you. Thank you, Mr. Chairman.
Absolutely.
I yield back.
Time has expired. I yield myself 10 minutes. Let me at the outset thank all the witnesses for your responses, your testimony, and your candor.
Commissioner, I think we're going to go further over here. We're going to do a little movement for you guys. Just a minute.
Move the flag.
Yeah, he was talking about moving the flags over.
Yeah, okay, so nothing is behind you? That'll work?
Yeah.
Okay. Gary, can you help me?
Yes. See how they scared to talk to you, Congresswoman?
Pardon?
They scared to talk to you, waiting on me to say it. Why you gotta be scared of her? I know since she was a baby.
That's right, he is much older. I can hear you. Okay, fine. Just get the thing on.
So the focus is on there are other committees of jurisdiction for these subjects.
Don't let you hide.
They all have budget ratification, and that's what we're doing today. So
Thank you guys for your patience. I'm on 2 congressional hearings.
Yes, ma'am. It's cool to listen in on.
Yeah. One is budget about research, and the other one was what we did wrong.
the budget going forward, and whether it's through.
I'll get you hooked up in cold water. That is the best water.
So what would be the budgetary implications of the reduced or?
So we're just the camera crew's here right now,
There is
and we'll be getting started here shortly.
what's his name?
You probably ought to turn that one down a little bit.
I am. Thank you.
Okay. Yes, I will.
I think the investments the United States has made in its university system and its primary and secondary education system from the very beginning, those investments in institutions that raise our skill, that produce human capital.
Put the water bottle behind it.
Do you have my handouts? The press thing?
It's printed out. That's the pink thing, and this one is for you. This is yours. That means that I did larger print. I'm printing the other. Okay.
Can you check with, he's almost off. Dr. John.
Sure. Get Benny Johnson on now.
Okay.
Can you check this person? He needs to come right to ours.
Okay.
Virtual.
How are the flags? Are they okay for this? Yeah. Are they okay for you? Whenever if you switch over to ours.
Thank you very much. Thank you. And I know that there's live streaming. I want to make sure that we are starting it appropriately. Congresswoman Sheila Jackson Lee, I represent the 18th Congressional District. I also chair the Bipartisan Coronavirus Task Force. And I want to make a point. This morning I participated in my committee hearings, my congressional committee hearings. I think everyone is aware that we're under a national crisis protocol in the United States Congress, where we're allowed to do our virtual hearings so that our business can continue. In addition to that, we're in the midst of our appropriations process, and so our committees are meeting and we are engaging with them. We've already testified. I've testified in front of all of the Appropriations Committee to ensure that Houston and Harris County and state of Texas is represented in our appropriations process. In dealing with the hearing that we had this morning, we had the governor of the state of Illinois, we had the mayor of Tupelo, Mississippi, and we had the emergency management director of Alabama, and of course we had Dr. Umar Shaw. With us today is my colleague, Congressman Joaquin Castro, who we'll hear from in a moment. Thank you, Congressman. And we'll hear from Dr. Umar Shaw, and of course to Commissioner Ronnie Ellis, a very important and pivotal part of our partnership leading on the issue of COVID-19 in Harris County. Commissioner, we are very grateful to you. And so we come this morning. I want to emphasize this afternoon again, we know these numbers are numbers that are presently those that we have seen, but the really decisive number is the 3 million cases, 133,000 deaths. We don't have an end to COVID-19. We may want it to end, but COVID-19 is not ending. Every focus in the United States Congress is to recognize that we may continue COVID-19 into the fall and into the winter. We're even concerned about the reopening of schools. That is a state issue, but the United States Congress is trying to address how we will be able to give direction to the Secretary of the Department of Education based on the appropriations to indicate that some school districts, some states should not open their schools. Parents are asking. There is a public health risk potentially, but we are obviously waiting to hear from the different states and the school districts to assess whether Congress would have to intervene. We do know that we have to intervene in the light of this crisis. And so we have already passed a HEROES bill that provides $75 billion more for testing and more money for our local and county government. What we learned today in the Homeland Security hearing is, one, there was no national strategic plan for COVID-19. Governor Pritzker, who represents Illinois, who can be symbolic of governors around the nation, believes that there would have been a less loss of life had there been a plan. He emphasizes how difficult it was to get PPEs and testing, and he also emphasized that testing was crucial. One of the things that was made clear by the Director of Emergency Management from Alabama, that if a group of 6,000 were coming to his jurisdiction based upon his governor's instructions, he would advise them not to come, not to come. And as I said, Governor Pritzker in his testimony indicated that he would knew that under the circumstances that if we had a strategic plan, we would not have lost the number of lives that we have. Where are we here in Houston, Texas? One, we're at 100% or a little bit under in terms of emergency room and ICU capacity. I was on a call yesterday in reviewing the needs of our hospitals, and they are in desperate need of additional nurses, doctors, ICU doctors and nurses, respiratory therapists, techs, all of that. And let me thank the FEMA and Federal Emergency Management Agency that is working with our hospitals, small and large, which I want to ensure to provide that extra capacity. Then what does it mean if in about 5 days, 7 days, that we will have 5,000 to 6,000 people in my congressional district in commissioner district that will be needing the full resources of our community. They will need a full resources of health care, food services, essential workers, security, and of course, if necessary, our firefighters for EMS requirements. We know that tens upon tens of firefighters are quarantined because of their exposure to sick patients. They were doing their duty. We know our officers, likewise, were doing their duty. We know that if we are pleading for nurses, we don't know if we will receive that capacity in the next 7 days. And so my colleagues have written to the governor of the state of Texas, who we have worked with collaboratively on many issues. Right now, we're trying to stem the tide of COVID-19. We opened by the governor's order in May 1st and then proceeded quickly to do so in our county and city, a fourth largest city, soon to be third largest city based on the 2020 census, and the county, which is one of the largest counties in the nation and will obviously rise in its size. Harris County is bigger than many states in this nation. And that means that you will tax all of the resources that we have to attend to 6,000 or more people who the question will be whether they will all be wearing masks, as the mandatory order requires, in an inside site that will have to be monitored. We know that the first occurrence about a mask is a warning, and then after that is a fine. Are we asking our law enforcement, constables, sheriffs, HPD to have to supervise this 6,000 group person? This, of course, is the Republican convention. In our letter, we acknowledge the idea of democracy. We acknowledge the freedom of people. But in conventions similarly situated, they have gone to virtual, and they have been successful. We know that there have been requests from local officials to not come, and we know that we have not gotten a response yet. We know the goal of the governor is to bring down the extensive number of not only COVID-19, but people who are dying. And therefore, members of Congress, myself, Congressman Vicente Gonzalez, Joaquin Castro, Mark Veazey, Representative Philemon Villa, Al Green, Sylvia Garcia, are among the members who have asked respectfully that we can't do this anymore. We must not have this number of people engaged in hotels with essential workers, food service, while we are trying to save lives here in Houston, Texas. So we make another plea, in the backdrop of the claim that the United States had the lowest mortality rate. John Hopkins has indicated that we have the highest, that we have the sixth worst mortality rate. So people are dying in the United States, and they are tragically and sadly as well dying in our own community, our neighbors and friends. I'd like to yield now to Congressman Joaquin Castro. Congressman, thank you. He is the chair of the Hispanic Caucus and is well aware, representing San Antonio, some of the burdens that we're all facing at this time. Congressman Castro, thank you. Can you hear me? Are you on mute? Can you hear me?
Mute on his end.
Yeah, he's unmuted. Congressman Castro?
He's frozen. Can you hear us? Can you hear me?
Thank you, Congresswoman, and it's great to be on with Congressman Jackson Lee, with the commissioner. Yeah. Y'all hear me?
What's the sound?
Yeah.
Could be our Wi-Fi here if he's at home. Looks like he's at home.
Yeah, it looks like it's not coming through for his video.
Can you hear us? We'll come back to you. Is Dr. Shaw? I'm going to try Dr. Shaw.
Dr. Shaw is coming. He's logging in now. He hasn't logged in yet.
Well, get him to log in on one of the computers over there, and we'll call up Commissioner Ellis. Can you work on that?
Okay.
So as I indicated, we have, as I indicated, we really think this is about public service, public health crisis. This is really about a public service and about public health crisis. Public service is all of the essential workers that will have to be utilized for any convention. Over the past couple of months, we have, through the leadership of the Mayor Turner and the county judge, canceled any number of enormous conventions. They have agreed and worked with the city. Many of them are postponed, and we understand that. We understand that this convention has a time sensitivity, but we also understand that technology has been very effective in conferences that have gone forward. I participated in them. If I might say, I gave a presentation for another convention that just occurred, and it was done virtually. I understand it was very successful. Commissioner Ellis has just come back from a virtual gathering of 110,000 people, virtually. And he is safe, they are safe, and COVID-19 is for the less, because we have not had people engaged. We cannot have Mount Rushmore here, Tulsa here, or New Hampshire here, because we are in the midst of a pandemic that is at the level of a crisis for the people of Houston, Texas. I do think that it is also important for our state government, and the work that they're doing is well respected, to assess whether or not, in order to put a stop sign at COVID-19, whether we need to use the science and medicine to engage in a stay-at-home order. That stay-at-home order will be based on science and medicine, and whether or not we can see a calculated, even either staying at a certain number or declining. And the only way that you would get to that point is that you institute a stay-at-home order. But I'm very grateful that Commissioner Ellis is here and who has experienced virtual action. We thank you, Commissioner. Please come forward. Thank you for your leadership on the COVID-19 issue.
So first I want to thank the Congresswoman. Have you ever seen anyone work this hard? In the midst of 2 hearings and then having a press conference. And I want to thank her for stepping out on an issue like this. It's important. So Congresswoman, I'll give you a virtual applause. That's a socially distanced. But look, it really is important. I want to say to our Republican friends, this really is a bipartisan and sincere gesture. I'm a Democrat, and I'm here to help you. At the end of the day, I think our government is better when both parties compete, do it in a noble way, don't make it personal, just based on policy differences. So here you have 2 Democrats saying, we want you to be alive. We want to compete with you, but we want to compete with you being as healthy as you can be. I know I have at least 3 or 4 challenges in my life. I'm older, I'm African American, I'm in politics, and I'm going to 4 more events than I ought to go to. What we don't know is all of the things that can keep this virus from spreading. You watch the news, and there's a new discovery every day. But the one thing we do know is that the safest way for you to stay safe is stay home. Now, most folks in local government want every hotel room, want you renting cars, we want sales tax revenue. If you really want to help us, just mail it, but don't come. So I want to encourage my friends on the other side of the aisle. I hope you do the same for us. If we were going to try to have a convention anywhere and bring 6,000 people into what is now, unfortunately, the hotbed of America. Only cities in Brazil have rates higher than ours, and we're all embarrassed by that. So I want to encourage them to think long and hard. Look, if there are things I can do to help show you how to do it virtually, I'd be more than happy to do it. I'll compete with my friends on the other side of the aisle on policies. I don't want to compete on the basis of putting someone's health at risk. And then for those workers, the people who have to go in, they'll have to serve the food, clean the rooms, clean the convention hall. That's so unfair to them. So I'm hoping that they will decide to cancel their convention and have a great one virtually. Thank you, Congresswoman.
Thank you. I'm so glad the commissioner said that we are sensitive to the fact that the city needs money. and that the best of all plans or the best of all results would be for these 6,000 people to come and spend money like they've never spent before. That's why we want this to be, as the commissioner said, and as I said, I believe in democracy, and I want to engage people on issues. But right now, I am frightened. I am really frightened for my constituents that will have to be on post from one end of the area to the next. I don't have any knowledge of any plans that there will be social distancing, meaning that they will take a large space and have those 5,000 people scattered out, and they'll all be listening on TV circuits, so they're not all congregating in one area. None of that has been presented publicly. And I also don't know if single parents who work as housekeepers and various other essential workers who have to support their family will then be put in jeopardy. I don't know what will happen if a group that are attending say, I'm from a certain area, COVID-19 in the state of Texas in my area is not important or it's not an issue, I'm not going to wear a mask. I don't know what happens. With all of those unknowns, that's why members of Congress who are putting the money down here, who are helping get more nurses and doctors and ICU, we have a perspective. And so if I could, I see Dr. Shaw, and I'm going to ask Congressman Joaquin Castro, representing the city of San Antonio that's facing its own health crisis with COVID-19. Are you there, Congressman?
Yes, can y'all hear me?
Yes, we can hear you now.
Great. Well, it's wonderful to be with you. Thank you for the invitation to be part of this, to speak about how dangerous it would be to Houston and to Texas for the Texas Republican Party to go forward with its state convention in person in Houston next weekend. Greg Abbott, the governor of Texas, has to step up and tell the convention that in the interest of public safety, it should not happen in person. Unfortunately, Governor Abbott has refused to make tough decisions during this pandemic. First, he turned it over to the local authorities to tell businesses that they had to close. And then he took local authority away and delivered the good news. He resisted for the longest time a mask policy across the state to make or to issue tough decisions. And from every corner of this would present a danger to the people of Houston and Harris County. And also because those folks, after convening, will go back to their hometowns, it's also a danger to San Antonio, to Dallas, to Corpus Christi, to El Paso, to Austin, to Fort Worth, to every single part of Texas. And the responsible thing to do is for Governor Abbott to call off the state Republican Party convention.
Thank you, Congressman. Thank you so very much. I'll stand over here. Let me just indicate that one of the things that we know does happen is when you're in close quarters, you can get COVID-19, as evidenced by the president's own security detail when they went to Tulsa. A number of his staff were in that category. Dr. Shaw has just testified before the Homeland Security Committee, and it really is a health issue. I think he heard me question Governor Pritzker regarding the mortality rate and what we could have done to avoid that, and that a strategic plan was important. We are working on a strategic plan here in Harris County. You are working on it, Dr. Shaw, along with the health leaders in the city. And of course, our leaders of the city, mayor and county judge have been working together as well. Can you tell us what the ramifications of having 6,000 people of any kind, fraternities, religious groups, or any kind, as much as we believe in the freedom of this nation, what it means to have people close together, possibly wearing masks, again, not socially distancing, and I think, as Congressman Castro indicated, then leaving and traveling to different parts of Texas. Doctor, are you there?
I am. Congresswoman, thank you for having me, and appreciate your support on the testimony that we just completed. I want to reiterate what I said earlier, which is that we are coming from politics aside and the reason that people are coming together aside, from a public health standpoint, anytime you have, especially indoors, right? There is an indoor-outdoor concern that, obviously a stipulation that we do need to be mindful of. But anytime you're indoors and you have gatherings of individuals for whatever reason, that is a concern to us right now, what we are seeing not just in Houston-Harris County, but across Texas with the increases in cases. Here locally, we're seeing increases not just in cases, but the number of tests are also giving us an increase in what we call the positivity rate, the number of those tests that are coming back positive. It was previously 1 in 8 or 1 in 10 of those tests were coming back positive. Now it's 1 in 4, with the concern being that may be sign of increased transmission in the community. And then number 3, with hospitalizations and the busyness that we're seeing in our healthcare sector, which is obviously a concern of all of us, because we've seen that be a big challenge and concern across the country, not just the country, but across the globe. So I would say that from a purely public health and a health and medical perspective, we're absolutely concerned about any time you have individuals that are coming together in a large gathering at this time in our communities, because of this real concern about how that may impact the health of that individual, but more importantly, how that individual may be then able to transmit, as you said, not just in our own community, but taking or going back to their home community. And now you have additional potential for risk and transmission in that community as well. And that's why I want to continue to emphasize health and medical and the public health aspects of what we need to do in order to assure the conditions that all of us can be safe and protected from COVID-19. And as you said, that is what we're working on as a community, as a county, as our partners at the city, certainly our elected leadership. And I just want to say thank you for having me on this important topic.
Thank you very much. If we can just, someone want to move this? I don't want to. I just want to indicate public officials are always looked to for solutions. Thank you so very much. We will get a handle on not talking while the mic is moving. Public officials are always charged with having solutions. And I think it is important, every person that spoke indicated that they appreciate the process of participation in a democratic process or a process of engagement where political views are expressed, and the importance of the participation of all the delegates that are coming. But the members of Congress wrote this letter to call upon the leadership of the state party and the governor to work together to be able to find a way to work with our local officials that can assure that that process is fairly continued, but that lives are not lost or endangered. And so what we ask is for this in-person convention to be canceled. But as we have seen faith leaders and various religious institutions or their days of worship have had a virtual interaction, and then they have been able to view that by the thousands in their respective homes and been able to engage. We have just seen a committee hearing, 2 of them, the House Budget Committee and Homeland Security, where there was engagement, because in these conventions there are committee meetings. That can be done virtually. Voting can be done virtually. And my understanding is that the city entities that deal with conventions are ready to be able to engage. So I ask that the solution be that both parties engage. The city is ready to engage. The county is on standby for whatever their support can be. Local officials are ready. I am aware of that. I don't choose to engage in the discussions that have been going on, but I know that there are willing negotiators ready to engage with this leadership of the state Republican Party and the 5,000 to 6,000 people that'll be coming. And we don't have a real handle on how many it's going to be. And what we do know, there are places that they need to stay, places they need to eat, healthcare concerns, mass concerns, and of course all of the support staff that will have to help them. Again, I think it's also important to note that both our county and our city, as every county and city across America, are struggling with resources. And that may include the money to pay, rightly so, overtime of our city workers, our police, our fire, and others necessary for these individuals. We know that conventions, no matter what party it is, Commissioner, are pretty raucous. They draw a lot of folk. And whether it is a Democratic convention, we draw our protesters. Rightly so, it's democracy. We know there'll be protesters because of the nature of the work. All of that will impact on what we're trying to do. And what we're trying to do is to find a way to close the gate on COVID-19 spiking. And I just want to say this, and I'll open up for questions. Dr. Vivian Ho, a health economist at Rice University, said we're on the verge of a nightmarish catastrophe. That is not Commissioner Sheila Jackson Lee or Congressman Castro. We're on the verge of a nightmarish catastrophe, particularly as it relates to bed space and medical professionals. And Dr. Forsey said that we're on a curve and it's going the wrong direction. And it is going the wrong direction in Houston, Harris County and the state. So I'm hoping my letter will be answered. Our letter will be answered. We're going to certainly pursue that and work with the individuals who should be hearing the call. And I hope this is taken in the text, in the context that Commissioner Ellis has offered. It's a perfect context. We all are engaged in this business. We would hope that someone would make an announcement and have a press conference and tell us with a convention not to have it. It so happened that we made that decision on our own with science and medicine. So we hope that this is not taken in any way other than to ask the question why and how we can get this done without jeopardizing a lot of people. And in the very hearing that we had, a nonpartisan hearing, the individual who was given an example of what they would do if 5,000, 6,000 people came into their state, and it was not Texas, and they said they would advise them not to come, according to the directions from the governor and their own belief. And that was a representative out of Alabama. Innocently gave their response. And of course, the governor of Illinois said that if we had a better plan, we would not have had all the fatalities of 133,000 that we have now. So I'll take questions.
Congresswoman, I spoke to a delegate to this convention, and she pointed to other events that the city has had in the midst of this pandemic, a funeral for a fallen officer, the George Floyd funeral, the George Floyd protest, and saying that the mayor apparently, sanctioned those, so why should theirs be treated differently? What's your response?
Well, I think those are excellent questions. I know for a fact the increase, it was more the family spreading during Mother's Day, Memorial Day, the beach activity that went on. And so I do think that the answer to that is that wherever we can, we are attempting to be responsible. So the responsible response, I think, would be virtual. The alternative would be, what is your social distance plan? That should be the question. In addition to the protests, they were not using facilities where they were staying overnight. They were not needing essential workers to attend to them with respect to funerals, and I'd like not to spend a lot of time on that. All of us realize the distinction in the honoring of whether a fallen deputy or the commemoration and celebration of life of our beloved George Floyd. I would not like to dwell on that, but what I will say, we all know the uniqueness and difference with that. But I also will say that there have been many funerals in this community that have adhered to virtual or social distance, and I know they have been in pain because I've seen those families. So I want to say that people are working in the arena that they can, and they're doing their very best. And so that's why we ask the convention to do its very best to ensure that everyone is safe.
How accurate do you believe the official Texas COVID-related deaths are? There is an article from ProPublica about more firefighters in Houston seeing more people dead when they arrive at home, and also there's been an increase in non-COVID pneumonia-related deaths from the CDC statistics.
Well, what we need most of all, let me just say, what we need alongside of testing, alongside of hospital beds and medical professionals is data. And in the hearing that we just had, we made a very strong point that the nation has not given us the resources to collect data. I would not doubt what first responders have been seeing, but we need to collect that data, because we know that in New York, it was actually represented in a hearing that I participated in, that the doctor said that people who could not get tests or came to emergency rooms and were not treated actually went home and died. Why did they do so? They got no care. And so there was a question of those numbers, were they counted? As you well know, in some of the darkest moments of New York, they were putting people in refrigerated trucks. We need data and calculation. I don't want to speculate, but the Congress is very concerned about that, and that's going to be an issue we take up, is how do we retrace our steps in all of the states and get a real number from all of the participants that were dealing with this terrible, terrible virus, this deadly virus, to give us the correct numbers. Your other question?
What would you like to see have more transparency relating to the data on COVID deaths?
Oh, absolutely. I think, first of all, data on COVID deaths is what the federal government needs in order to even construct a strategic plan going forward. We are suffering because there is no federal plan. My question is, what is the federal plan for the potential surge of flu, as you said, and COVID coming up in the fall? At that time, children may be in school. Teachers may be in school, obviously. Parents may have either gone back to work or themselves trying to teach at home. People may have made some effort to begin working. As I said, I believe there should be a stay-at-home order now based on science and medicine right now. Better time to have it than to face a mounting surge and go into the fall. So yes, I think the data is crucial, but that's a federal government challenge to help states and local governments, give them the resources, provide them with the team that helps guide them on the data collection, and have the appropriate agencies to receive that data. Again, you know what we need? We need a federal strategic plan. Even though it's late, we should have had it in January of 2020 or December of 2019. But right now, we need that plan that will answer the question about data. Everybody gets their assignment. States, you are responsible for providing data. You are not able to ignore that request. If you don't have it complete, give us the incomplete data. I don't think that that is as strong a process as it should be. Any other questions? Thank you.
Thank you. Let's talk tonight.
Thank you.
All right.
Thank you all.
Thank you.
Dr. Shaw, Congressman, thank you so very much. Can you hear me?
I got it.
He closed out.
He's busy.
Remington, if you
Yes,
don't mind, we could just shoot it right now,
Yes.
if that's okay.
Shoot what?
The letter.
Okay. I mean, I was gonna email it to you.
Oh, okay.
But
Oh, you
if
have
you
it.
want to do it with her, then that would be more